My name is Emedi Babele, and my community health need assessment project is on reducing the rate of sexually transmitted infections in Fayette County, Kentucky. Executive summary: Fayette County, Kentucky's community health need assessment implementation plan aims to reduce sexually transmitted infections, STIs, by 20% within a year. Strategies include education campaigns, policy advocacy, community engagement, increased access to testing and treatment, and monitoring and evaluation. Education campaigns focus on prevention, symptoms, and treatment, while policy advocacy focuses on comprehensive sexual health education, funding, and reducing stigma. The plan aims to develop champions who prioritize social justice in prevention and treatment. Monitoring and evaluation will monitor progress, aiming for 20% reduction in STI rates. Community defined. Fayette County, located in Kentucky's inner bluegrass area, is home to the city of Lexington and spans 284,52 square miles, with a population of around 320,347. The county has mixed demographic composition with 76% white, 16.2% black or African American, 4.4% Asian, and 7.6% Hispanic or Latino. The average family income is $62,908, and the per capita income is $41,855. The county's housing market is affordable, with a median value of $261,800 for owner-occupied homes and a typical gross rent of $967. Fayette County, named after French Commander General Marquis de Lafayette, has a rich history dating back to the early days of the American Revolution. Since 1974, Fayette County has maintained a unique cooperation with Lexington, resulting in a dynamic pair in local governance. Here's a map of Fayette County showing boundary, county seats, major cities, highways, water bodies, neighboring counties. You see Fayette County is surrounded by Scott County, Woodford County, Bourbon County, Clark County, and Jessamine County. Public health significance of STIs. Sexually transmitted infections, STIs, are a significant health issue in the United States, involving viruses, bacteria, fungi, and parasites. They can be acquired through various sexual activities and close physical contact. Common STIs include bacterial vaginosis, chlamydia, genital herpes, gonorrhea, HPV, MGen, syphilis, and trichomoniasis. Some illnesses like HIV and AIDS and viral hepatitis are also transmitted through sexual contact. To prevent STIs, individuals should learn prevention techniques and engage in safe sex. STIs in Fayette County. Fayette County, Kentucky faces a significant public health issue due to high STI prevalence and the impact on its population. Factors like stigma, lack of affordable health care, and limited sexual health education contribute to the spread. The fact that high school students and college students tend to engage in hazardous sexual behaviors also contribute to the spread. Collaboration between public health officials and community leaders is crucial to reduce STIs and improve overall health. Implementation plan. The improvement model will be used to implement the community health needs assessment in Fayette County, Kentucky. This model enables systematic development, testing, and refinement of initiatives to address community health needs. The model uses quality improvement methodologies and statistical process control instruments to evaluate the benefits of change. The implementation strategy focuses on reducing sexually transmitted infections, STIs, and ensuring the achievement of specific, measurable, attainable, realistic, and time-bound objectives. The slides that will follow will present some of the key aspects of the implementation plan. Primary objective. The primary objective of the SMART goal is to reduce sexually transmitted infections, STIs, by 20% within 1 year. This measurable goal aims to reduce new STI cases and is time-bound. Targeted prevention programs and education initiatives will be implemented to achieve this goal. STIs can have serious health consequences if left untreated. By setting a clear goal, implementing effective strategies, and measuring progress, this objective can improve public health outcomes and reduce the burden of STIs on individuals and communities. Team formation. A multidisciplinary team, including public health professionals, community members, healthcare providers, and educators, is crucial to addressing public health challenges. This team should include experts in epidemiology, health education, policy formulation, community involvement, healthcare practitioners providing clinical knowledge, and educators developing information dissemination techniques. This team can bring new perspectives and solutions, promoting population health and well-being. They can interact and exchange expertise to solve public health concerns comprehensively and strategically. Data collection and analysis. Data collection is crucial for understanding sexual transmitted infections prevalence in a community. It helps public health professionals tailor preventive efforts to at-risk groups, identify service gaps, and develop targeted treatments. These community health needs assessments will use both quantitative and qualitative methodologies to gather comprehensive information. Available data on STIs in Fayette County. Chlamydia and gonorrhea are the most prevalent bacterial STIs in Kentucky, with rates nearly doubling since 2000. In 2020, 727.2 new STI cases were reported in Fayette County, a stark increase from the state average of 419.7 cases and the US average of 481.3 cases. In 2021, 684.3 new chlamydia cases were diagnosed per 100,000 individuals in Fayette County, Kentucky. The increasing trend in STI rates is a national issue, with over 2.5 million reported cases of syphilis, gonorrhea, and chlamydia in 2021. Syphilis rates are also increasing consistently, surpassing levels not observed since the 1950s. STIs in Fayette County. Here's a graph obtained from county health rankings showing the progression of chlamydia infection in the United States, Kentucky, and in the Fayette County from 2007 to 2021. And you can see that Fayette County is getting worse in terms of chlamydia infection compared to the state of Kentucky and to the United States. Resource allocation. The initiative will focus on outreach and education initiatives, particularly for high-risk demographics like adolescents and young adults. Funds will be allocated for community seminars, school-based education programs, and informational campaigns. Access to testing and treatment services will be enhanced through funding for healthcare providers and clinics. Programs addressing poverty, substance misuse, and low healthcare access will also be funded. And multifaceted approach is needed to effectively reduce STI rates. Stakeholder engagement. This project will prioritize stakeholder participation to ensure the community's needs and concerns are met. Contacting community leaders, schools, clinics, and local groups will gather opinions and information. Conducting focus groups and surveys will enhance stakeholder participation, enabling a data-driven approach to decision making. This will foster ownership and trust, leading to a more effective and lasting effort. This will ensure the project effectively serves the community's needs. Intervention strategies. Strategies include education and awareness, access to testing and treatment, addressing social determinants of health, community outreach, partnerships with advocacy groups and public health organizations. Education and awareness will be promoted through workshops and partnerships with clinics and pharmacies. Access to testing and treatment will be provided for free or low cost, and resources will be made accessible to those without insurance. Addressing social determinants of health, such as poverty and stigma, will promote a healthier society. Community outreach programs will include health fairs, mobile clinics, and awareness campaigns. Partnerships with advocacy groups and public health organizations will be essential for achieving these objectives. Evaluation plan. The evaluation plan for interventions will focus on measuring the effectiveness of educational sessions in raising awareness and encouraging safe sexual behaviors. It will also assess the accessibility of STI testing and its impact on prompt treatment. The plan will also evaluate community knowledge of STI dangers. Regular monitoring will help make informed decisions about resource allocation and future treatment development. The plan will include assessing the effectiveness of educational sessions, assessing the reach of the intended audience, and assessing STI testing accessibility and evaluating community knowledge. Adjustment and success celebration. To improve the effectiveness of interventions, it's crucial to adjust them based on data analysis. This may involve changing instructional materials, increasing testing hours, or addressing unexpected obstacles. This adaptability ensures a more personalized approach to meeting community needs and overcoming obstacles. Celebrating accomplishments such as lower STI rates or increased testing is essential for community engagement and long-term success. This instills pride, encourages support, and motivates people to continue enhancing public health outcomes. Here's the timeline for the project. Month 1, planning and preparation, which will include forming task force for STI data collection and funding. Month 2, community engagement and awareness, which will include launching public campaign and collaboration with local organizations. Month 3 to 4, screening and testing, which will include establishing free clinics and mobile units, ensuring service confidentiality. Month 5 and 6, treatment and support, which will include implementing treatment programs and support services, implementing partner notification services. Month 7 and 8, education and prevention, which will include implementing comprehensive sex education programs, conducting workshops and seminars, distributing condoms and preventive supplies. Month 9 and 10, monitoring and evaluation, which will include analyzing data and making adjustments. Month 11 and 12, reporting and future planning, which will consist of compiling a final report, developing a sustainability plan, and ongoing continuum improvements, which consists of holding regular meetings and getting feedback and reflection. Disseminating assessments and program results. The target audience includes local physicians, community members aged 15 to 26, healthcare organizations, policymakers, and other stakeholders. To establish credibility, the research will be published in peer-reviewed journals, and community forums and seminars will be conducted. Educational materials will be generated, for distribution to community centers, schools, and institutions. Social media platforms will be used to engage with younger community members. The goal is to increase awareness and encourage preventive measures. Possible study limitations. Potential limitations include self-reporting bias, restricted generalizability, and inaccuracies in data. Surveys and focus groups may be influenced by participants providing socially desirable responses. Data may be unique to the evaluated community, not applicable to other populations. Incomplete or inconsistent documentation may impede reliance on medical records for STI information. It's important to consider these limitations when interpreting results and implementing interventions. Reflection. The number of sexually transmitted infections, STIs, in Fayette County, Kentucky has risen significantly due to hazardous behaviors and inadequate healthcare access. A community health needs assessment initiative aims to reduce STI prevalence by 20% within a year. The initiative focuses on improving healthcare access, increasing education, and raising awareness. A multidisciplinary team of professionals, including healthcare providers, educators, community members, and public health experts, will develop strategies and interventions to curb the rise of STIs. Data collection will be conducted through various methods, and stakeholder engagement will be prioritized. Education and awareness campaigns will provide reproductive health and discuss STI transmission rates. Partnerships with pharmacies and clinics will be strengthened, and community outreach initiatives will be implemented.